Dr. Jay Kim from Monument Health in Rapid City is an interventional neurologist specializing in health problems related to the brain, from spotting the injury to conducting surgery.
I work with other specialists, such as neurologists, stroke doctors, neurosurgery doctors, intensive care doctors, and yeah, I would work with them to diagnose the disease, and then if treatment is necessary, such as a stroke treatment or aneurysm treatment, then I would go in with a special machine that we have at Monument Health to uh, do the procedure.
Strokes are the most common diseases interventional neurologists will see.
If someone comes in with a bleeding or a stroke, that is ischemic stroke or clot stroke, we're trying to figure out why did they have that happen, such as, is there a blocked blood vessel? Is there aneurysm in the brain? Is there a malformed brain blood vessel? And that would require interventional neurologist.
Interventional neurology began in the 1980s, but limitations of technology impacted the medical field of studies impact.
In terms of stroke treatment, such as removing the clot, um, the FDA approval for this actually occurred in uh, 2015. Um, so you can imagine this is only 7 years ago that it got FDA approval, and it took that long to develop all these technologies.
Today's interventional neurology methods are much different than some of the extreme methods used as the field was discovered, particularly in dealing with aneurysms.
The traditional method was you would have to basically open up the skull and then go through the brain, or by going around the brain, that is, and then you would locate the blood vessel that uh, bled, which is a blister aneurysm that bled into the brain area, and that would be the traditional method. You would go through around the brain and then basically locate the aneurysm, and then you would put a clip on the aneurysm, which is kind of similar to a cloth pin, if you can imagine, and then you would pinch off the blister.
Thankfully, advances in interventional neurology surgery have made safer strides thanks to minimally invasive small incision techniques.
At this point, majority of the aneurysm treatments are done in a minimally invasive fashion, and majority means greater than 80% in the nation, where we would go through the blood vessel in the body all the way up to the brain, and then instead of from the outside, we would go through the brain blood vessel into the blister pocket, and then we would basically seal that up.